Thank you so much, Jessica, and good afternoon, APHA. Welcome to Philadelphia. You've heard from my boss, Michael Nutter, and I hope you understand why I believe I'm the most fortunate public health official in the nation. It is my great honor to work with him and the other leaders here in Philadelphia on moving forward his agenda, which is quite active around the public's health. As Commissioner of the Department of Public Health, I'm delighted to welcome you today, to meet you, to get to know people who I don't know. I've been a member of the association for nearly 30 years, but know that each year new, particularly younger members come. We want to welcome you as a city to the association and to Philadelphia. Many of you were here both in 2001 and 2005 for the APHA annual meeting. We were honored to be able to step in for New Orleans in 2005 in the wake of Hurricane Katrina, and I want to make special note that it's wonderful to see the recovery of that great city over these 4 years. As pretty much everyone before me has told you, this is a city of firsts. We were the first to have a public hospital, the first to have a hospital. I hope you will take time to go see the hospital which Benjamin Franklin founded in 1751, which is Pennsylvania Hospital, an easy walk from here. In addition, you've heard about many of the education firsts. What wasn't mentioned is that we were the city with the first nursing school, the first medical school in the nation, the first eye hospital, the first cancer hospital in America, and as was stated, but I want to reiterate, in Philadelphia, the first woman in the nation was awarded a doctorate of medicine. We are an incredibly vibrant city. You are sitting in the downtown in America into which the greatest proportion of workers walk to work. So as each of you is working over the next 3 days, I hope you will take a break and go out and walk. We are a flat city in a valley between two rivers. There is no excuse for people not getting out and exercising in Philadelphia. If for no other reason, go see our murals. We are the most muraled city in America. We use public art not only to beautify and reduce graffiti, but we use the production of public art under the Mural Arts program in Philadelphia to bring constituencies together to advocate for the needs, particularly of those who are disadvantaged in Philadelphia. Murals bring people together to represent the life of those with mental illness and the needs of all communities, to embrace those who are substance affected and those who are returning to communities from prison. Please go walk around this convention center and adore the murals that you will see. In addition, as the mayor mentioned, and I have to reiterate, we have the highest childhood immunization rates in the nation. You can clap again. We have active and vigorous lead control, disease control, clean air, HIV treatment and prevention programs, and the rest of the services that we all know in public health departments. In this coming January, I am pleased to report, we will also join cities that are using menu labeling to make the public aware, aware not only of calories, but also sodium, fat, and carbohydrate contents in restaurants throughout the city. I want to acknowledge our partners in this enterprise of public health in Philadelphia, in particular, the Drexel School of Public Health, with its fine faculty and students, headed by Dr. Marla Gold as Dean, who is a longtime friend and incredible partner in my job and to the department and public health in this city. In addition, we have strong public health programs at each of the major health-related universities in Philadelphia: Temple University, Thomas Jefferson University, the University of Pennsylvania, and the University of the Sciences in Philadelphia. And I note it was in alphabetical order. I also want to acknowledge our many nonprofit partners. You heard from Public Health Management Corporation, the Maternity Care Coalition is here, the Health Federation of Philadelphia is here, and many, many other nonprofits. I can't list them all. I thought I would choose this time, and next time around I'll tell you a few more. At the same time, we, like other cities and towns in America, as you know, and around the world, are faced with the economic realities that challenge our ability to maintain health services for all of our residents. This is the second American Public Health Association annual meeting since the beginning of the Great Recession of 2008. In that time, our own unemployment rate has risen above 10% for the first time in decades. There are an additional 20,000 people living without health insurance here in Philadelphia. We know that during the last year, close to 160,000 Philadelphians report not seeking care because they couldn't pay for it, and 211,000 adults in this city report that they did not fill prescriptions for medication because they couldn't pay for them. We don't yet know the impact of the recession beyond what we would think of as health services. Are there more hungry children, for instance, in Philadelphia and in each of your communities? I think that's likely. What we do know is that in some areas we have been able, under my boss, the mayor's leadership, to blunt and hopefully avoid, because we're not out of the woods yet, some of the impacts of the recession. For instance, there has been a 6% reduction in the number of individuals sleeping on our streets because they are in permanent housing. The extraordinary partnership that the mayor has made happen with our director of the Public Housing Authority, Carl Green, means that the number of children living in shelters in Philadelphia is down to its lowest point in more than a decade, despite a recession. Towns and cities across our nation, I know, face the same crises as our city. My hope is that through this meeting, we can all begin to share best practices, best experiences, and what we are doing to lessen the damaging impacts of the economic crisis. Perhaps, in the disruption to people's lives, we can teach and promote new ways to behave and new ways to organize, particularly the health care system in this country, that will benefit the public's health in the future. We can't only see this as a crisis. I hope we can see it as an opportunity. Mayor Nutter and I are committed to addressing health in a broad context here in Philadelphia. It's the reason for my Health and Opportunity title. It means that not only does the Department of Public Health report to me, but also the Departments of Behavioral Health and Mental Retardation Services, Human Services, and Homeless Services. I have a seat at the table with a very small group of leaders who determine the direction of the city. It means, for instance, that health impact assessment is now integral to city planning in this city. It also means that as a city, we are committed, visibly committed, to promoting health by promoting not just health services, but by promoting the full dignity of every man, woman, and child in this city. It's a rare pleasure for me to address an audience that shares so fundamentally and so...
Please welcome our 2009 American Public Health...